Hello, this is Stuart from Bonnerig RV Life. Lisa and I are currently in Quincy, Washington. We usually talk about RV stuff. For this one, sitting in my car, just about home. If you look around here, give you a quick view, nice view. Anyway, I want to talk about Venlafaxine, which is a antidepressant. It has a trade name or brand name, Effexor. I've been on Venlafaxine for about 5 years, and before that 15 years or more before that I've been on Wellbutrin and citalopram, both antidepressants, SSRIs, selective serotonin reuptake inhibitors. They make you happy. I was put on those drugs 20 years ago or more because of suicidal ideation and diagnosed clinical depression. But 5 days ago, due to change in financial circumstances and just because I decided to quit Venlafaxine, is it? I don't know. I decided to quit cold turkey, which is not recommended. But for me, I was only on 37.5 milligrams, at least for the last few months. I was initially on 75 milligrams per day, and other folks that I've read about and watched on YouTube, they may be up to 375 milligrams per day. So the withdrawal symptoms can be pretty severe, and most people who come off this drug do it by reducing the dosage by 37.5 milligrams every 2 weeks or so. Well, I decided, since I'm only on 37.5, should have been 75 milligrams, but months ago I cut it in half. Again, probably due to financial circumstances, but also because I felt that that was enough. It was working, which for me is to keep suicidal thoughts at bay. Well, I stopped dead five days ago. So I just wanted to briefly give you the symptoms. So the symptoms I've been experiencing are like foggy, light head. I've had a couple of brain zaps, which is like a static electricity discharge, but inside your head, as opposed to off your fingers if you have some static electricity. Had a couple of those. I think they would be more severe had I been on a higher dose. And irritability and bad moods. And of course, maybe the irritability and bad moods is just me. Maybe that's not a withdrawal symptom at all. But anyway, for anybody who's thinking about coming off this drug, I think it's Venlafaxine or any other antidepressant, you really should see a doctor. I chose not to do that, mainly because, again, my primary care physician is in South Florida and I am in Washington State right now, so it wasn't really feasible. But again, took the risk considering that I was only on 37.5. So it's been 5 days. I've been driving around today, just heading back home, and just wanted to post this and let people, anybody who may be thinking about coming off the drug, what to expect. And do not do what I did, unless maybe you're only on 37.5. Rather go and discuss it with your doctor, okay? But I'll pop back again on this topic in 2 or 3 weeks. I believe the symptoms may take 2 months or even more to subside, and I'm not sure again if the symptoms such as bad moods are just not me. But right now I'm drug free, except aspirin. I take 1 aspirin a day because of heart issues that I have experienced. I had a cardiac arrest back in 2017, I think it was, and so I take an aspirin every day since then. But at the moment, drug free, and that includes alcohol and any other type of drug. So we'll see how it goes. Just be happy and be careful.